Now, most of the volatile acid is buffered by what? Volatile acid is what? CO2. You don't want acid in the body, we exhale CO2. We want more acid in the body, we don't exhale much of CO2. It is the hemoglobin which is the main buffer of the carbon dioxide, as all of you know very well. Now, the various receptors which you have to be very sure. Pacinian corpuscles are important for vibration. Ruffini's end organs are very important for the knowing of the intensity of the pressure which is underlying our skin. Now, it is the actin which is common protein in both the smooth and also striated muscle. Once more, doctor. Contraction of the muscle. In the NEET PG question bank, there is a topic. We have hacked the computer. Let me tell you. Definitely one topic, one question will come on muscle contraction. Smooth muscle, skeletal muscle, cardiac muscle. In which case you have myosin, light chain phosphokinase. In which case you are having the sarcoplasmic reticulum. Troponin, where do you have? What is tropomyosin doing? All these things, hardly 5 pages. But 1 out of 20 questions you are bound to win in the tomorrow's exam. Let me vouch for you, doctor. Now, coming to the fat soluble vitamins. It is the lipase which is very important in order to digest and absorb the fat and the fat soluble vitamins. Give me one loud answer. Maltose fermenting gram negative diplococci are which organisms? One loud answer. Microbiology, those 15 bucks are going to creep into your crevices of the brain. Who will give me the correct answer? That's good. Dr. Anuja says gonococci, Varun says meningococci, Guntur says in general Neisseria. Is a safe way of playing the playing with the STD by saying Neisseria. I am asking gono or meningo. Who will give me the correct answer? There is only one standard question, doctor. There is a very standard question, there should be standard answer. Just like if you say, oh, I love you so much, then immediately what is the standard question? Why only me? Then what is your standard answer? Because your best friend rejected me. So that is the reason. So you must be ready with standard questions, standard answers. There should not be any confusion at all. Okay. Gram negative diplococci means we think of only 2. Neisseria meningitis and Neisseria gonorrhea. Meningococci ferment both maltose and glucose. Gonococci ferment only glucose. This you have to be 100% sure. There should not be a sudden surprise for a question that why only me. Now coming to the next question, intergastric volume. Intergastric volume is the one which increases the gastric emptying. You must know fat content, acidity, osmolarity of the lumen of the small intestine. They are all the ones which basically act to inhibit the gastric emptying, and the initial rate of emptying depends on the volume of the meal which is being ingested. Now what protects the duodenal mucosa from the acidic digestion is what you have to be very, very sure about, doctor. Pancreas produces alkaline-rich secretions in response to secretin, and it is the secretin which is responsible for protecting the intestinal mucosa. Unlike the gastric mucosa, in gastric mucosa there are a lot of defenses like prostaglandins, maintain mucosal integrity, so many things are there, no? They are not available in case of small intestinal mucosa. Now coming to the insulin secretion, this is a favorite question of the examiner. There is a change in the answer. Answer becomes C, not B. It is the glucagon like polypeptide which is the product of the glucagon metabolism in the L cells of the lower intestine. And just like gastric inhibitory polypeptide, the glucagon-like peptide is the physiological B cell stimulating hormone. Insulin secretion is typically stimulated by the glucagon-like peptide is what need to be remembered. What is the main source of all the gas which we find in the case of intestine, doctor? So it is basically derived primarily by the fermentation of the undigested material by the intestinal bacteria which produces CO2, which is the main cause for the formation of the gases. If you remove the entire colon, whom you are removing? Our good Samaritan friendly bacteria which are living with us since our childhood. What is their job? Every day they are converting NH3 to NH4 and preventing us from getting encephalopathy. So if you remove colon, you remove bacteria, there is nobody to detoxify NH3 and NH3 concentration increases and leads to hyperammonemia is what you have to basically remember. Now doctor, I think the answer is out. Charcoal yeast extract means nowadays you are all barbecue champions in answering this question as Legionella, no big deal. Okay. Now trypsinogen to trypsin, typically it is the enteropeptidase which is very important. This is an interesting question. Secretory diarrhea versus osmotic diarrhea. What is the difference? Osmotic diarrhea means, what is the main cause of osmotic diarrhea, doctor? Suppose you happen to ingest a substance which is poorly absorbable but osmotically active, then it will draw the fluid into the lumen and lead to the development of the diarrhea which is called osmotic. But one important way to differentiate is, if you go into fasting, then no more you are ingesting that osmotically active substance. Diarrhea also will stop. So fasting relieves osmotic diarrhea but not secretory diarrhea, which is the main difference. Similarly, what are the causes of the osmotic diarrhea? Anybody suffers lactase deficiency, or if you are taking a magnesium containing antacids or laxatives, or if you have ingested sorbitol like sugar, any of them can lead to development of osmotic diarrhea, but osmotic diarrhea stops if you do fasting. Secretory diarrhea doesn't stop. Then you will also take the stool and check the osmotic gap. Osmotic gap is increased if it is osmotic diarrhea, but it is normal if it is secretory diarrhea, is what the second other important difference. Whenever you rotate towards the right, what happens? So many things happen, but a simple way to remember this answer is, if you move your head towards your left, unless your both eyes moves towards the right, then your fixation point get altered. You don't want to alter the visual fixation point. Hence, whenever you turn towards the left, your eyes will conjugately move to the opposite side, towards the right, is what need to be fundamentally remembered. Then I leave to you in the literature all that what happens in the cupula, everything is easier to read rather than being explained. Now, after traumatic brain injury, which is the most important center for the heat production, doctor? It is the anterior hypothalamus, which has got all those thermoreceptors which are located in the anterior hypothalamus. What is the cause of malignant hyperthermia? It is the ryanodine receptors which are genetically abnormal and they release the calcium without nerve impulse. Also they keep releasing calcium in the sarcoplasmic reticulum, and that excess release will lead to the malignant hyperthermia, is what you have to fundamentally remember. Now give me an answer, doctor. I am asking a question. Hot tub folliculitis, you heard of it? It is caused by one aerobic gram-negative rod I want to know from you, which is oxidase positive, non-lactose fermenting, grape-like odor it produces. It produces an endotoxin and also an exotoxin which can inactivate EF2, elongation factor 2. Too many clues given. What is your answer? I know Dr. Kirti is first to answer correctly. Pseudomonas is the one which you need to basically remember. It also produces that blue-green pigment. We use aminoglycoside plus anti-pseudomonal penicillin like piperacillin, ticarcillin, and malignant otitis externa in the diabetics. Think of Pseudomonas is what need to be remembered. Now once there is an increase in the sodium conductance, it leads to the end plate potential of the skeletal muscle fiber also to get elevated, and that initiates a sequence of activity which lead to the neuromuscular coordination of muscular contraction. Now if you stop the blood flow to a ventilating alveolus, what happens to in the V by Q value? It becomes 0. So V by Q may denominator 0 ban gaye to what is 1 by 0 called? 1 by 0 is not 0, it is infinity, right? If you block ventilation with good perfusion, then V by Q becomes 0, right? Just like alveolar collapse will lead to V by Q 0, pulmonary embolism will make V by Q become infinity, as all of you know. Now what happens to the partial pressure of the oxygen in the alveolus? It can't move into the blood. That's the reason it remains equal to the inspired air, because there is no diffusion happening into the blood capillary is what need to be remembered. Now coming to when the lung approaches deep inspiration, fully inflated, what will happen? Typically the intrapleural pressure become more subatmospheric, more negative at the time of inspiration, approaching almost minus 30 centimeters it will go to at the total lung capacity. Then whenever the lung volume increases and reaches a full blown state, then the compliance of the lung decreases, elastic recoil increases, so that the lungs will resist further expansion. So there is a second thing which will occur. So lung compliance basically will decrease, and the pulmonary vascular resistance typically increases in full inspiration is what you have to fundamentally understand. Now coming to the ventricular ejection, what happens to the pressure difference magnitude between left ventricle and aorta? Only when the pressure difference equalizes, then only forward flow will occur. So that is the reason it becomes almost equivalent, and the difference will minimize at the time of the ventricular ejection is what need to be fundamentally remembered.